My name is Lindasia Orr, and I'm from New Day Academy. And my question is, you think we are getting closer and closer to finding a cure for AIDS? And if you think so, how many years will it take for them to find a cure for AIDS?
You know, that's a terrific question. And, you know, when you talk about worldwide plagues and worldwide pandemics, since 1981, over 25 million people have died of AIDS and HIV infection, and millions more are alive and living with that. We, the experts, have been wrong time and time again in thinking that we were close to a vaccine for AIDS or something that could cure the virus. A lot of people have come forward with ideas about cures, about vaccines, for a lot of reasons having to do with the virology of the HIV virus. That has not happened. And I think that that work's still going on. And I think we're somewhat more sober in understanding that that is going to be a very, very difficult virus to find an absolute cure for. There's a lot of new drugs on the horizon. Now, the good news is that there are so many drugs out there to control the virus, that people with that disease are now living 10, 15, 20, 30 years. Our hope is that people can actually have a normal life expectancy, even when they're infected with the HIV virus. And we're getting closer to that goal. So work is continuing on a cure, on a vaccine-type cure. But I think we've been sobered up by the fact that there's so many times we thought we were close to that, and when tested, it didn't work out. So we're going to keep trying. But the good news is the drugs that are out there to control the disease, not cure it, control it, are very successful. And we're hopeful that people can have normal life expectancies even after they're infected with HIV virus.
Which presidential candidate do you feel supports the importance of public health education more?
You know, that's a great question. And since you brought up politicians, the way I'll answer it is this. You know, if you saw the presidential debate Tuesday night, there was a question as to whether health is a right or a responsibility. The actual question was, is it a right, a responsibility, or a privilege? And the two candidates answered that question differently. One said it was a right, and one said it was a responsibility. And of course, they're both right, because it's a right and a responsibility. With every right comes responsibility. When you get a license to drive a car, that's a right. You have a right to drive a car, but obviously that carries a lot of responsibility with it. You have a responsibility to obey all the traffic laws. You have a responsibility to use that huge multi-ton vehicle in a way that doesn't endanger anybody else's health or your own. And the same thing is true in health. Everybody, every baby who's born, every person living in the United States ought to have the opportunity to live the healthiest possible life that they can live. But everybody has to share in the responsibility for that. We've got to make good decisions, whether it's not smoking cigarettes, having a healthy diet, taking the right kind of safety precautions in any activity, whether it's bicycle helmets or motorcycle helmets. There's a whole range of things, getting preventive health care. We have a responsibility to ourselves and to each other, so that if we're going to exercise that right, where everyone has the right to be as healthy as they can be, we absolutely have to exercise the level of responsibility that goes along with that right. So like a good politician, did I avoid answering that question?
I'm Admiral Steven L, and I'm from Newberry High School, and my question is, are you getting any closer as a medical community to solving cancer, the mystery of cancer, and treatment for the patients?
The progress on cancer has been absolutely spectacular. About 5 or 6 years ago, the head of the National Cancer Institute, set as a goal cutting the number of cancer deaths in half in 15 years. And it is possible that that could be achieved. There has been tremendous progress in screening for cancer, early detection, and in the use of treatments for cancer, but not for all types of cancers. Some of those have been much more successful than others. The other part of the problem is getting people to take advantage of the screenings that are out there. And one of the things that you'll see, and I'm sure you have it in Cleveland, there are mobile vans that go around to communities and do cancer screening where people live. They set up a big van and they do the cancer screening there. So we've made tremendous progress, but there are still far too many cases of cancer, far too many cancer deaths, and we're doing as much research as fast as we can. So we've made tremendous progress, and I think it's possible that we could achieve cutting in half the number of cancer deaths a year, but it's going to take a lot more work to do that.
Hi, my name is Brianne Pragg, and I'm a senior at Midview High School. Today, at the City Club of Cleveland Youth Forum, we have been listening to Rear Admiral Steven L. Solomon. Before you go, we would like to ask you to fill out the surveys on your tables and return them at the door. Thank you to our distinguished speaker, and thank you, ladies and gentlemen. This forum is now adjourned.